Welcome to the DIA Global Annual Meeting Virtual Edition, PharmaVoice Editors Take video series. In this episode, Taryn Grome, Editor-in-Chief of PharmaVoice Magazine, meets with Erica Prowisor, Global Head, Recruitment and Retention, IQVIA.
Erica, welcome to the virtual 2020 DIA Editors Take program. As we all deal through the pandemic and self-quarantining, it's great to visit with you in your home office.
It's great to have you with me. Thank you so much for welcoming me today.
It's our pleasure. And speaking of COVID-19, as we look to recover from the pandemic, how do you see the acceleration of the clinical trial landscape having an impact on patient recruitment?
So from my perspective, the pandemic has essentially stopped traditional patient recruitment. We've lost months of traction on studies, and we're now focusing on how to accelerate and basically make up for lost time. On a positive note, even though we have that pressure to make up for the time that's been lost, we actually now have an added pressure to be innovative, and it sort of has put a fire under us to find new ways to keep research going in light of the pandemic. So from a site perspective, it's encouraged us to look for new opportunities to support sites with enhanced services. So we've been looking at everything to possibly reduce site burden, and that includes simple data entry all the way up to staff augmentation, where we may be actually conducting visits as an extension of the study staff, for example. From a patient perspective, we're finding new ways to engage virtually. We want to make sure that we stay in touch and that our messaging is on point, even though we're talking to people from their homes, much like we are here. And we're also very focused on when we bring patients back into the office that we are socially distancing and really keeping patient safety top of mind. There's also, in light of everything that's happened, as far as patients are concerned, a new increased and, in my opinion, positive focus on research and the need for clinical research as a whole because of the pandemic. So what's happening is that people have been sitting at home. There has been a lot of fear and concern, and they've wanted to help. And the way to help is obviously clinical research, participating in things like vaccine studies, and individuals are really looking for ways that they can participate. And we believe that there's going to be a halo effect with that in mind, where individuals are going to hear about other research opportunities, even if they're not related to COVID, and potentially be more open to opportunities than perhaps they would have been in the past.
I think that halo effect is such an important piece of this equation, because it is the bright spot amongst all of this seriousness during the pandemic. So that's a great point. How are companies using their own data and global healthcare data sets to find and engage with patients? And then as a follow-on, how does that data change the recruiting process now? And what do you see are the potential benefits?
Yeah, so now more than ever, having the right data matters. So if you think about the context again of what's happening, many sites, as they're opening, are quite honestly overloaded. While it was really not a good thing to bring patients who weren't qualified into a site prior to the pandemic, now when there's very little time and many sites have had to furlough people and they're trying to, as I said, catch up on their studies, bringing wrong patients in because the data wasn't accurate is catastrophic in many cases. So it's more important than ever. What I'll say is that if we flip it again to the patient experience and patient safety, that's also key. And so the more data we have about patients, the more likely it is that we're going to get the right patients to the right trials. And that's important not only for obviously the patient experience and the site experience, as I mentioned, but even with the backdrop of COVID, for those who, are at-risk populations, for example, or those who've had exposure to COVID during this crisis, you want to have data and correctly assess that you're not putting them in jeopardy by participating in other trials. And so having that data, being able to truly understand the patient profile and making sure that you're taking all the right precautions is critical. And one additional layer that I'll just throw on to the mix is that even with what's happened with the pandemic, many studies have moved to virtual components, and that could be part of a hybrid study, or it could be, completely moving virtual in certain aspects. And so not all patients are equally receptive to virtual trials. And so again, using data to find the right patients where virtual trials are meaningful for them and they're willing to participate can help be more efficient if, again, you can optimize using the right data to really match effectively to patients, trials, and sites that work well together.
Excellent point. How does a direct-to-patient recruiting approach help to accelerate patient recruitment?
So from my perspective, the direct-to-patient recruiting approach, especially in this time, is critical. As virtual studies, for example, become more mainstream, or even, partial virtual trials, we'll call them hybrids, become more mainstream, having the ability to directly recruit patients will become more and more important. So if you can't go to your site databases, you need to go directly to patients to fill those trials. Even for traditional studies, there's a financial trade-off that happens and that needs to be assessed. What happens is when you onboard studies, there's a cost to onboarding studies, and at some point, there's a tipping point where it is more expensive to add a new site and expect that site to recruit all your patients than it would be to add patients from the community and send them to a smaller number of sites. And so ultimately, you need to have, going back to the data to do the math correctly so that you understand the balance between onboarding new sites and finding patients in the community, ultimately so that you can correctly optimize based on the sponsor's goals for their timelines of the study and the cost restraints that they may have associated with delivering that trial.
That DTP approach works right now during the pandemic. And do you think this is going to be the future of clinical trial recruiting?
100%. Again, just reiterating what I mentioned, direct to patient as we move virtual, and ultimately as we, start doing the math of what it costs to onboard sites versus doing finding patients directly and engaging them. It's not, from my perspective, it's never going to be 100% going to in-practice patients or 100% direct to patients. It'll be a blend, and depending on the protocol and really what, again, the sponsor is looking to achieve, there will always be, in my opinion, an opportunity for both, depending on what the goals of the study are.
Excellent. And what advice do you have for sponsors on how to take a more holistic, human-centered approach to recruiting?
Yeah, so as things become more and more virtual over time, and as technology is leveraged to be more efficient through the trial process, it's really critical that we don't lose touch, not only with patients, but also with the medical professionals who conduct the trials. I mean, we're all humans, and there are burdens and things that will impact how trials are conducted, and we need to be thinking about them in our trial design and in our recruitment. And when you're recruiting for studies, really every stage of what's happening within both, again, the site and the patient experience should be assessed. For patients, it really starts, in my opinion, with having an understanding of why the patient would want to participate in the first place. Are they dissatisfied with their current treatment options? Are they looking to clinical research as a care option? Perhaps their disease is hereditary and they're concerned about their children or family members. And it's important to really understand, why are they moved to go ahead and participate in the first place? And once you understand that, and you're able to use technology and automation to deliver the right level of education, you're able to deliver the right messaging and the right timing for all of that, you really will have the ability to optimize performance. So if you go at it and you really don't understand the humanity behind it, for sure you're not going to be able to optimize in the same way. And for sites, again, it's important for the sites to also have that type of transparency and understanding. The more that they understand about their patient backgrounds and the patient motivations, and the more support that they have to give the best experience to patients who participate in trials, the better the outcomes for the trials are going to be. So it's important for us to recognize and acknowledge that sites have many competing trials. They have a lot of administrative tasks on their plate, and being able to use technology and data to help ease the burden for sites and then match the right patients to those sites for the trials will empower that site staff to dedicate more time and attention to what matters most, which is essentially, again, their patients. So I think that as we, consider all the elements and we add that level of humanity into the experience, everyone who's a stakeholder in this process will be better off exponentially.
I love that. It's a win-win-win-win for everyone then.
Exactly.
Excellent. Erica, thank you so much for being part of our virtual Editors Take Video program as we go into DIA 2020. Thank you.
It was my pleasure. Thank you again for having me.
For more information about IQVIA, visit www.iqvia.com.